Bursitis: causes, symptoms, treatment, and prevention. What is bursitis? Bursitis is a painful condition that affects the small, fluid-filled sacs called bursae, which cushion the bones, tendons, and muscles near your joints. When these bursae become inflamed, they cause discomfort and limited mobility. There are more than 150 bursae in the human body, and when one becomes irritated, it can lead to pain and swelling. Common causes of bursitis. Bursitis can develop due to various reasons, including repetitive movements. Frequent repetitive movements such as kneeling, lifting, or throwing can irritate the bursae. Prolonged pressure. Activities that put prolonged pressure on a joint, such as leaning on elbows or kneeling, can lead to inflammation. Injury or trauma. A sudden impact or fall can cause bursae to become inflamed. Infections. In rare cases, bacterial infections can lead to septic bursitis, a serious condition requiring medical treatment. Underlying health conditions. Conditions such as rheumatoid arthritis, gout, and diabetes increase the risk of bursitis. Aging. As people age, bursae may become less resilient, making them more prone to inflammation. Symptoms of bursitis. The symptoms of bursitis can vary depending on the affected joint, but typically include pain, a dull aching pain in the affected joint that worsens with movement or pressure. Swelling. The area around the joint may appear swollen or puffy. Tenderness. Touching the affected area may cause discomfort. Redness and warmth. In cases of infection, the skin over the bursa may become red and warm. Limited mobility. Pain and swelling can restrict the movement of the affected joint. Common types of bursitis. Bursitis can occur in various parts of the body, with some of the most common types including shoulder bursitis, common in athletes and workers who perform overhead movements. Elbow bursitis, often caused by prolonged leaning on the elbows. Hip bursitis, more common in women and older adults, often caused by prolonged standing or excessive walking. Knee bursitis, seen in individuals who kneel frequently, such as plumbers and gardeners. Heel bursitis can develop due to excessive walking or running. Diagnosis of bursitis. A healthcare provider can diagnose bursitis through physical examination, assessing pain, swelling, and movement restrictions, image testing. X-rays, ultrasound, or MRI scans may be used to rule out other conditions. Fluid analysis. If an infection is suspected, a sample of bursal fluid may be taken for analysis. Treatment options for bursitis. Conservative treatments. Rest. Avoiding activities that exacerbate the conditions can help recovery. Ice therapy. Apply ice packs for 15 to 20 minutes several times a day reduces inflammation. Compression. Wrapping the affected area with an elastic bandage can provide support and reduce swelling. Elevation. Keeping the affected joint elevated helps minimize swelling. Medical interventions. Physical therapy. Exercises to strengthen muscles and improve joint flexibility can prevent recurrence. Corticosteroid injections. In cases of severe pain, steroid injections may be administered to reduce inflammation. Antibiotics. If bursitis is caused by an infection, antibiotics may be necessary. Aspiration. Draining excess fluid from the bursae can relieve swelling and discomfort. Surgery. In rare and severe cases, surgical removal of the bursa may be required. Prevention strategies for bursitis. Taking prevention measures can significantly reduce the risk of developing bursitis. Practice good posture. Proper body mechanics when sitting, standing, or moving can prevent joint stress. Warm up before activity. Stretching and warming up before exercise or physical activity reduces strain on joints. Use protective gear. Wearing knee pads or elbow cushions can help prevent excessive pressure on joints. Avoid repetitive motions. Taking frequent breaks during repetitive tasks can minimize strain. Maintain a healthy weight. Reducing extra weight lessens the burden on joints. Strengthen muscles. Regular exercise to strengthen surrounding muscles helps support the joints and reduces the likelihood of bursitis. When to seek medical attention. While mild cases of bursitis can often be managed at home, you should seek medical attention if pain persists for more than 2 weeks despite treatment, swelling or redness worsens, You develop a fever indicating a possible infection. The affected joint becomes immobile or extremely painful. Bursitis is a manageable condition with the right combination of rest, treatment, and preventative measures. By understanding its causes and symptoms, individuals can take proactive steps to protect their joints and reduce inflammation. If you experience persistent or severe pain, seeking medical advice is crucial to ensure proper care and recovery. By staying active, maintaining good posture, and taking precautions, you can keep your joints healthy and minimize the risk of bursitis interfering with your daily activities.